So hello all and welcome to this session. I am Dr. Ankit Khandelwal, your anatomy educator in Unacademy platform, and this session is for the important topics of anatomy for our upcoming NEET PG exams and other valuable exams. So what we have done in this session is basically we will be discussing the names, the topics, the important topics which are the potential questions for our next exams. So I'll give you a complete list of those important topics, and in this session I'll be briefing you just a couple of lines, 2, 3, 4 important lines about each topic. In the upcoming sessions, what we are planning over here is that we will be taking each topic or maybe a couple of topics in small sessions, and we'll cover up the important aspects, the important parts of it, applied part that can be asked in the exams. Plus I would urge all of you to write in the comment box if you have any suggestions or any topics of your interest that you are finding it difficult and that you think could be a potential topic and important topic for the upcoming exams. So that way also it will help us and to create the future sessions and the topics. So still we have ample time before our main exams of NEET PG 2023, and we are building up from here so that we have a strong foundation so that we can cover up and we can get a good score and we can get a good rank in the exams. Let's start the topic. The topic of the session is, as we have placed the important topics anatomy, and Dr. Ankit. Few updates before we proceed further on, and that is your NEET PG 2023 All Educator Ultimate Revision Batch that is already started on 30th of September, right? So duration is 6 months. The details are over here. Next we have, after this we have this FMG December 2020 exams also. We have a last mile revision batch, important aspects given over here, and already started in the month of September on 16th of September. Then you have this latest update QBank part 2 or version 2 that is now available. So just have a look at it and you will, I'm sure that you are going to love it, right? So these are a few updates, and next enjoy 20% off on all your NEET PG subscriptions. All the duration given, the current price, and these are all the savings, and some discounts are over here, and you can use the code of Dr. Ankit 10 you can use, or you can use NPG 10 or any code, right? Okay, so these are a few updates. Let us start with the session. So I will be starting with the head and neck, and subsequently I will going through other parts like neuroanatomy, thorax, abdomen, upper limb, lower limb, embryology, histology, all those aspects, right? So just a briefing of the topics. So what you can take out from this session is that you can note down the important topics if you are not aware of it, or if you are aware then you have to check that are these all topics under your checkpoints or not. So everything should be covered, right? So that is our objective, so that we should not leave any stone unturned and get a maximum chances of getting the questions correct. So in head and neck, we all know it's quite a big topic, but we are going to divide it. And let us see, the first topic that I figured out is the skull foraminas. The main foraminas and the contents and how to identify them is all what we are going to see in the skull foraminas. Remember, if you want to go through this topic, particularly this foraminas, I have done a couple of special classes and also a YouTube class for only the foraminas. So you can check out that. Main meniscal foraminas are required over here around 10-15. This is a basic skull cranial fossa is what we are looking on the right half of the cranial fossa is over here. All the main foraminas are labeled over here. So that in details we can discuss later on, but already there are few sessions. You can go in the past also and you can have a look at it if you want it right now. Apart from the skull foraminas, another important topic in anatomy. See, when we say anatomy, it is not just anatomy, it is actually the applied anatomy part. And normal anatomy will not come in exams. Because the theoretical anatomy is not going to be useful for a medical professional. You need to have an applied or a surgical anatomy sort of knowledge. So each part of anatomy which we will see over here, remember always that its applied is the one that is most in use. So, and the topic from head and neck is the scalp. Obviously the layers and applied part of each layer. Black eye is one of the couple of small applieds written over here, cephalohematoma versus capitocidinium. You should know what are the 5 layers of scalp, what happens if there is a bleeding in one layer versus a bleeding in another layer, which is a dangerous layer, what is the nerve supply, is it highly vascular supplied, what are the other aspects of it. Very important topic, the scalp, right? Just a couple of images showing over here On the left hand side we are seeing the nerves, basically the sensory nerves. On the right hand side we are seeing the vessels. Remember the scalp and the nose, these are few areas where you get branches from both the internal and the external carotid arteries, right? So highly vascular supply and various other things. Just a briefing over here, showing you a couple of images. In this image, showing you the sensory map of the face as well as the scalp. So you can see anterior half is basically by the trigeminal nerve, and the posterior half of the scalp is basically by the cervical plexus. Cervical plexus plays an important role over here. If you go back to this image, this is a trigeminal nerve, anterior to it, posterior to it we have the cervical plexus that will be supplying it. Just a brief idea. Now coming to the, just continuing from here, if you look from the front and the face, again in the face, the sensory supply, remember the sensory supply, we are not talking of motor, but the sensory supply is your fifth nerve only, except a small area that is frequently asked, and that is around the angle of the mandible, and that area is supplied by the great auricular nerve, this nerve over here, the great auricular nerve, right? So only around this area, that is around the parotid region, the sensory supply is by the great auricular nerve, that we should be knowing. Let's move from here. आगे बढ़ते हैं. And the next topic over here is the face. Face, right? Again, I repeat, in each topic, focus on the applied part. Focus on the applied part. That is important. Trigeminal sensory map is what we have just seen. See, shingles over here, trigeminal neuralgia over here, Bell's palsy over here. These are just to name a few applied aspects which we see on the face, which have an anatomical relevance behind the pathology, right? So the face, we have to see a few things, a couple of images we will see further on. And then the dangerous area of face, we know the nose area and the upper lip region, this area. Why it is known as dangerous area? Because you should be knowing that it has a communication with the cavernous sinus. The veins over here have a direct and an indirect communication with the cavernous sinus, and therefore it's a dangerous area. Again, it is of applied importance. Acne pimples, they're so common on the face of teenage boys or girls, and they may be squeezing it all the time. So we, as a medical professional, you have to tell them that don't squeeze it because of this anatomical correlance, right? Then moving from the face, cavernous sinus, a high yield topic over here. The cavernous sinus is read more in the brain, but yeah, brain, head, neck, they go hand in hand. So cavernous sinus location is very important. They are paired sinuses. On the sides of the sella turcica, these are present. Related structures, which structures are related to it? What are the lateral relations? Which cranial nerves are laterally related? Which structures are passing through the cavernous sinus? What is the applied importance, surgical importance? So all our surrounding anatomy of the cavernous sinus is very important. And just when applied, we already saw in the previous slide, that is a dangerous area of face with the cavernous sinus. A very, very important dural venous sinus is our cavernous sinus, remember that, right? So it's an important topic. Here we are seeing the vascular supply of the face, and the lateral view, you can see the lateral view, anterior over there, posterior over here. This over here is representing the cavernous sinus. This is the cavernous sinus, and this is the facial veins. You can see the facial veins are directly and indirectly communicating with the cavernous sinus, and as these are volvulus veins. Problem over here is these veins are volvulus veins. So once you try to squeeze them, a thrombus may pass from the facial veins to the cavernous sinus, direct or indirect route, and that can cause obviously problem. Patient may develop CST, that is cavernous sinus thrombosis, and that is an ocular emergency. It is not a good sight to see. Although the eyes become very dreadful, right? So cavernous sinus thrombosis and some basics anatomy over here. Many things we can identify from this image. Look at the tortuous facial artery. Look at the dots in the facial artery as it is grooving inside the submandibular gland. Look at the facial vein which is not tortuous, right? Look at the formation of the external jugular vein. Look at the internal jugular vein, how all the veins are draining into internal jugular veins. Many things we can take out from an image, right? So these images are going to help us further on. Let's move from here, a very, very important slide over here. We'll just discuss it more in detail, but just giving a brief idea. This is about the seventh nerve palsy. You have a UMN and an LMN palsy. LMN, also known as the Bell's palsy. So this over here is the LMN, the Bell's palsy. That is a UMN, upper motor neuron, mainly involved when there is a problem in the cerebral cortex or in the brainstem. The patient will develop a upper motor neuron palsy. But how to recognize it? See, if only the lower half of the face is involved, it is probably a upper motor neuron palsy. If the complete half of the face is involved, and that involvement is of the motor involvement, So if you ask the patient to raise your eyebrows, if you can see complete horizontal lines over here, the upper half of the face is fine. So lower half face may be involved depending on the grooves over here and the folds over here, and the saliva may be dribbling down from here. Person may not be able to whistle properly. So all these things, right? So when only the lower half of the face is involved, you should be high suspicious for the UMN palsy. UMN alone seminar will not be involved. You have to see for other long tract signs, symptoms, and other whole story. So that goes in a different direction. LMN palsy, we all know the Bell's palsy is one of the most common things. Other things can also be involved in the facial nerve LMN palsy over here, right? Moving from here now, very important slide again. What is this? This we will discuss in detail, but just giving an overview. Can you identify it is which vessel? If you look at the branches, let me just name a few branches. Pharyngeal artery, posterior deep temporal artery, anterior tympanic artery, inferior alveolar artery. We are basically dealing with the largest branch of ECA, that is the maxillary artery. Another very important topic, maxillary artery, divided into 3 parts, and all the 3 parts have the different branches. So in our sessions, you might have seen my previous sessions, past sessions. If not, then we will try to conduct some new sessions also about how to remember them, right? What is the trick to remember them? Because this certainly becomes a very important and difficult topic. I really remember my UG days when we first studied the maxillary artery branches. It was like a mission impossible to remember the branches. But slowly we developed tricks, we developed some logical common sense, and that is why we are sharing knowledge here with you guys. So maxillary artery, and the important topic is the parotid gland. See, any topic which has applied importance, a parotid gland, so many pathologies. Take out a surgery book. Whatever topics are there in surgery book, they have the relevant anatomy, and that is important. Simple as that. Do you have a parotid chapter in your 11 Bailey? Obviously we have it. It becomes an important topic in anatomy as well. So relations, nerve supply, duct applied, Frey syndrome, histology now. That is what you don't see in surgery normally. But histology is very important for parotid gland. In pathology you will see about it. How to differentiate the parotid from the submandibular and the sublingual gland in histological slides. You might be remembering guys that कुछ सालों से क्वेश्चन आ रहा है from few years about the cartilage. Some years they place elastic cartilage, some years they may place fibrocartilage, some years they may place hyaline cartilage. Then questions are coming histology from cerebellum. People get confused in cerebellum or cerebrum. Same way, this is a confusion in histology to differentiate the parotid from the submandibular sublingual gland. Remember, it is a serous gland, so it will have serous acini. The sublingual has a mucus, so it will have a mucus acini. Submandibular will have mixed sort of. So just features to differentiate them. And other things, Frey syndrome, also known as auriculotemporal syndrome, XY, so many things about this parotid gland, important topic. Just a couple of slides. This is a transverse section showing you a transverse section of the parotid gland. This is on the outer surface, that's superficial outside. There is some deeper aspect facing towards the pharynx. This bone over here would be the mandible, and behind you have the mastoid process, right? And the muscles attached to it. And the important structures lying inside parotid gland, that is all very important. This question or this image, the question didn't came as an image per se, but there was a direct question from this image. If you remember, a couple of years back or maybe last year, the question came about that if you are operating on a submandibular duct, which nerve is prone for injury, and you should see this is a submandibular duct, and there is a nerve which double crosses it. Once from lateral to medial, then medial to lateral, which double crosses it, that is a lingual nerve branch of mandibular nerve. That was answer. So images are going to help you a lot. Few years back, questions used to come about the relations of hieroglossus. So you can see the hyoid bone over here and the muscle going from this quadrilateral sort of muscle going from hyoid bone to the tongue, that is hieroglossus, and this lingual nerve, hypoglossal nerve, submandibular duct, these are all superficial relations to the hieroglossus muscle. So these sort of questions have come, right? Let's move from the parotid gland. We now come to another gland, that is the thyroid gland. Needless to say how important it is for surgical importance, for ENT importance, and both of these subjects are relied on anatomy. So you have to first take care of the anatomy. And thyroid gland also, you see congenital issues over here. So you need to know its embryology also. First point therefore I placed over is the embryology. Embryology thyroid gland, cause we say that okay, the person has a congenital issue, but you may not see a thyroglossal cyst in a 1 day old or 1 week old baby. You may see Hieroglossus after a person, a child may attain 2 years of age, 5 years, 8 years, 10 years, 15 years maybe. So things which look post-natally have a congenital or a embryological correlation. Embryology is important in this particular topic, right? Then relations, obviously, because when you're doing a surgery, relations needed. Remember the relations of recurrent laryngeal nerve, the external laryngeal nerve, the arteries, all that is important. Fascias, because you don't reach the gland directly. You have to go through the skin, the superficial muscles, the superficial fascia, the deep fascia, then you will reach. So you should know a basic anatomy of the fascia. What you are cutting with the scalpel, you should be knowing about it. Vascular supply, histology again over here. And the thyroid gland, you have the parathyroid gland as well. So becomes a little bit more important topic for the anatomy perspective. Next we see over here the parasympathetic ganglions. We always, when you open an anatomy book in head and neck, there are 4 main ganglions, parasympathetic ganglions in head and neck. Starting from here, ciliary ganglion, pterygopalatine, otic ganglion, submandibular ganglion. Both the afferent or the preganglionic and the postganglionic nerves should be clear. Where is the ganglion located should be clear. What is the ganglion supplying should be clear. This topic should be clear. There are mainly 4 parasympathetic ganglia in the head and neck, and everything out. Not everything, there are only 3-4 things in each ganglia. What is the nucleus, which is the preganglionic nerve, what is the postganglionic nerve, and what is the target organ which is this ganglion is supplying. That is all you need to know. That is all, right? Important topic. Here, as I am discussing with you, thyroid gland. So this is a little bit of embryology of the thyroid gland. You can see the hieroglossal duct over here, coming from the foramen cecum part of the tongue, going down in the front part of the neck, looping below and behind the hyoid bone, then going down, finally dividing in 2 lobes, forming the 2 lobes of thyroid gland connected by the isthmus. And then you have a pyramidal lobe there, which is slightly maybe on the left side, that represents the downward descent of the thyroglossal duct. Right? So there can be a lot of anomalies over here that we should be knowing. Anterior view of the neck, showing you the vertebral levels. On this image is important. They are very, very important images. One of the important images is this. So they are showing you the vertebral levels. So that is important. Now, why is this important? Some people may ask, why is this important? I will tell you later on. See this image. This is a hyoid bone, thyroid cartilage, thyroid gland. This is a cricoid cartilage, and behind this isthmus. Isthmus is in front of the tracheal rings. Cricoid cartilage is around C6. You all should remember why, because from here the larynx and pharynx ends and the trachea esophagus starts. At this level the larynx pharynx will end, and below this the trachea esophagus will start. C6, remember. Hyoid bone around C3, just below the level of mandible. But now question is, why do we need to remember this? Because you know about the importance of CT scans. And CT scans, you should be knowing at which vertebral level, because here you are not seeing the vertebrae, but in CT scan you will see everything. You will see the entire cross section. You should know at which vertebral level what is happening, what are the major structures. You should have a rough idea. That is the use of anatomical knowledge. That is the use of anatomical knowledge, because if you suddenly see the CT and you have no anatomical knowledge, right, I don't know, the C4 vertebrae, what should be at this level, I don't know. You should know a brief idea. And that will, these knowledge are going to help you in your radio questions, any of the applied questions, right? So this was the relevance of this vertebral levels. Next important topic, again, deep cervical fascia. Theoretically, it is very important topic, but more importantly, because practical knowledge is what you need over here. This topic may look a little bit confusing, no? Deep cervical fascia, it is nothing a deep fascia of the neck. We have deep fascia in the upper limb, we have deep fascia in the lower limb, fascia lata in the lower limb, we have deep fascia in the neck. Simple as that. It has few layers, and like investing layer, prevertebral, pretracheal, basic idea. Again, many of these topics, I won't say all of them, but yeah, most of these topics, if you go to my previous sessions in YouTube or in special classes, some of them you may find, right? And also, I repeat again, write in the comment box if you want some new topics over here, so that we can take special sessions on those only. So yeah, deep cervical fascia, dangerous layer, and applied anatomy, all of that has been discussed in detail. Just a couple of images over here. This is again a TS. As I was telling you, this is again a TS. Right, you can see a cervical vertebrae over here, the trachea, esophagus, all these layers. I'm not going to discuss the detail right now, just giving you an idea that this is how the thing appears. And that is showing you the neck, the side of the neck. And with the deep thoracic fascia, we also should know a little bit of the triangles of the neck, particularly the anterior triangles, anterior and the posterior triangles. And there's also a very small triangle posteriorly below the occipital bone known as suboccipital triangle. Though it is very small, but give 10 minutes to it. Question you don't know. You don't know when a question may appear. Anterior post triangles, we remember it all the time, and that is important. I'm not saying it is not important. It is very, very important. This is applied importance is not that much, but even then it has some applied importance. So invest your 10 minutes on this triangle, suboccipital triangle also, apart from this, after going through this. Right. Next, you see over here a topic, the important cranial nerves. There are 12 pair of cranial nerves, fine. If you can read all of them, nothing like that, but at least revise the third nerve, fifth, all the three branches, V1, V2, V3, 7th, 11th, even the 12th cranial nerves, maybe 10th also, but 10th we read a lot when dealing with heart and lungs. So when you look at or when you pick a cranial nerve to read about it, right, you should first of all you should know the course of it. From where does it start? From which part of the brainstem does it start? And if you can correlate it in a form of functional component, your half of the job is over. Half of the job is over. Why? Because before you read about the nerve, you already know what this nerve is going to function. What is the function of this particular nerve? That is functional component, like visceral afferent or visceral efferent, somatic afferent, somatic efferent, and things like that. So if you know the functional component, you start the course over here, automatically the nerve will give off the branches which will be functioning the components, and obviously then you may know the applied anatomy of it. Simple as that. So take each nerve, 1 to 12, all are important, but these are slightly more important, and remember their functional components. This is actually the crux. I'm telling you the way to remember, because still you guys have got a lot of time, seriously. So you can go through it. You can give your half day or half day is enough, half day, 2 cranial nerves at least. Like 3-4 hours you can give to all the cranial nerves, things will be clear. And there are many lectures of mine for functional components. You can take a relevance from them also. It will help you in save your time a lot. Okay. So functional components, once you know this, you know the branches, and with the course you will go to the applied anatomy part. Next we come to what we are discussing, the functional components. Some of you may be wondering, sir, ये functional components we are not able to recall, because anatomy होता है first year subject, then obviously you have around 15-16 more subjects to read. Obviously anatomy, it is near to impossible to remember it after 4-5 years. So functional components are what is, you can see over here, it is a brainstem section, and inside the brainstem you can see a group of nuclei. These are a group of nuclei cell bodies, and they will combine, they will form the cranial nerves which will go outside. So this determines what is the function of each cranial nerve. What is function of each cranial nerve, right? That is what. Then a very, very small topic regarding the neck, triangles and cranial nerves is the ansa cervicalis. Very small, छोटा topic है, but important. It will hardly take you 10 minutes. Very, very important. Location of it should be clear. The branches of it should be clear. I'm just showing you image over here. This lies in the anterior wall of the carotid sheath, and it supplies all the strap muscles. Strap muscles meaning by these muscles which are covering the anterior part of the neck. So it supplies all the strap muscles except which muscle? Except the thyroid muscle. So it will supply the sternothyoid, omohyoid, except this thyroid. This is a strap muscle which is not supplied by the ansa cervicalis. It is individually supplied by C1 separately. Remember that. A small topic, but important. Next we come to this topic, and this over here is about the carotids. Both the carotids basically arteries. The external carotid, the internal carotid. Right, both of these are carotid arteries. Very, very important. Give your at least 20-25 minutes of this topic, or request me in the comment box to put a session on this only. But will not take more than 15-20 minutes. But both the internal and external carotid, you should know their course, their branches. Embryology also, because you may see, or you may find in the questions, a lot of congenital anomalies for the carotids as well, the branching of carotids. Right, so that topic is important. Next we come to the TMJ and the domesticatory muscles. Again, images, muscles, actions. Again, a lot of applied part over here. You should know the type of joint. All the muscles over here. This is the TMJ over here, and you should know the muscles, their actions, because applied part is much over there. And all these masticatory muscles supplied by the V3 nerve, And as previously discussed, the V3 was important, cranial nerve, right? Next you come to this nose and PNS again. ENT topics, ear, nose and throat. ENT part of head, neck only. So whole you can say the whole branch is a part of the head and neck, ENT. Ear, nose and throat. It is a whole branch which is a part of head and neck. You can understand the importance of ear, nose and throat. Though it's anatomy, you will again revise an ENT part, but better you start revising from the anatomy perspective. So nose PNS, all the PNSs, paranasal sinuses, maxillary, all that, these are very, very important. Where are the opening? The site is very important. You should know the exact meaning of the nose. What is the whole, this anatomically, how big is the nose, right? Just a figure over here, a cadaveric view of the lateral wall of the nose. This is not the medial wall. Medial wall is always a septum, which might be deviated, but this is a lateral wall. It's quite irregular. Why? Because there are a lot of concas over here. Concas are medial projections from the lateral wall. And deep to these concas, you can see a cut concha over here. There are openings over here known as meatuses, where the paranasal sinus is open. Right? So I hope you may be knowing about it. This is the hard palate over here. That is the SP soft palate. Right? This is the vertebrae behind. This is the what we call it as part of the skull bone, and that is the vertebrae from here. C1, C2 over here. That is the nasopharynx. You can see the opening of the auditory tube. A lot of things you can see from this particular image and other things, right? Now we come to this tongue and tonsils. Tongue, tonsils, oral cavity. Needless to say, both of their embryologies are very important. Nerve supply, histology, all these are important. Next we come to this larynx, pharynx. Again, a part of ENT only, but again their images, the muscles, movements, relations, all are important over here. Larynx, recently updated, hyped topic, asked in many exams, so go through the larynx part. You may see this luckily as one of our past sessions, larynx over there, a couple of YouTube sessions if I recall correctly, so you may have a look at it. All the larynx muscles actions are described over there, you can have a look at it. Some tongue muscles are shown over here. There's a pharynx muscles, the three constrictors over here, because pharynx is just like upper continuation of the esophagus, so a lot of peristalsis occurs over here, right? So these are a few topics from the head, neck, and now the neuroanatomy part. I'll discuss some topics on the neuroanatomy part also over here. Consequently, we'll see neuroanatomy. See, anatomy images, neuro images. Why? Because again, radiologically also neuro part is very important. Radiologically and neurophysiology, neuromedicine. If you are aiming for the PG in neuro and allied subjects like for Niemens and all, again this is very, very important. Very, very important. So images, all cadaveric images very important. Systems are there, we'll see more about it. Other topics like long tracts and applied medicine part comes over here. Medicine or surgical, mainly medicine, neuromedicine, neurology. Person came with a stroke, okay, having a long tract signs. So long tract signs in the spinal cord as well as in the brainstem, these are very important. But yeah, here basically the spinal cord they are saying, so it is also surgically important. Brown-Sequard syndrome, hemisection, applied anatomy, have a look at it. Ventricles. Now these ventricles are basically the CSF filled cavities, right? So for fourth ventricle, third ventricle, few things are important. Like in fourth ventricle, the floor is important. Why? Because the floor of the fourth ventricle is lying just behind the medulla and the pons. Then the relation of third, because third is in the midline and it is surrounded by diencephalon and a lot of other important structures. We shall have some images also. That is very important. Cerebellum. Needless to say, anatomy, physiology, neuro, medicine, it's all very important. Different pathways are over here in the cerebellum. Histology is also, I told you few minutes back, the importance of it. Functions, all the deep cerebral nuclei, the tracts, the Purkinje fibers, there's so many important parts in cerebellum. A small topic but a very, very important topic. And please don't go into details of anatomy, that will not be very useful in the exam part for if you're aiming for NEET PG and all. Because if you open up the neuroanatomy book, there will be a lot of things over there. All the names of the different lobes will be there, right? That is not very much needed, but basic idea should be clear. How the tract is going, how to identify, where is the dentate nuclei, the most important deep cerebellar nuclei, and if the afferent is coming from where, how it is making contacts in the cerebellum, and where is the efferent going, how it is going, and what would happen if there is any lesion. What will happen, same side of the body will be gone or the opposite side, and why. These things are there in cerebellum that you need to know with images. With images, anatomy images are important. That is the point over here. General features of the brainstem syndrome. This, again, neuromedicine part. There's a rule of 4. I hope that most of you are aware of it. There's a rule of 4 over here. If you're not aware, then you can see my previous session, the brainstem, special classes, well as in YouTube, I'm not sure, but special classes obviously there are there, or the brainstem syndrome. Please have a look at it. Basic idea with MCQ practice, very important, because there are not 1 or 2 brainstem syndromes. There is midbrain, pons medulla, and these have 2 or 3 syndromes in each part, lateral or medial and this and that. So understand that. With help of MCQs, images obviously will help. Gyri in sulcis with Broadman's number. See, what will come in the exam which is clinically important. If you go to the neuro wards, you'll see a lot of cases of stroke, right? Maybe some seizures cases also. Hemorrhagic strokes could be there, ischemic strokes could be there. Problem lies mainly in hypertension and cardiovascular diseases. Point over here is that the cerebrum is quite involved, commonly involved in neuro cases, and therefore you should know which gyri and sulci involved and what is the function of it. Not every gyri sulci, but yeah, most of them, important ones you should know, at least 10, 12 are there, you should know. Which side is dominant side, and what is the use of it, what is the Broadman number of it. Major numbers are mainly for the Broadman numbers. That should be clear. Aphasias are very commonly asked. Broca's, Wernicke's, global aphasia, and other aphasia also are there. So at least general idea, where are they located and how to diagnose them, what are the specific points to diagnose them. Okay, over here. Then diencephalon, nuclei and phonics. Diencephalon includes the thalamus and the hypothalamus parts. The nuclei are very important, not all, but important ones. Let me give you a rough idea. In say hypothalamus, around 7-8 nuclei you should know, their function, their names, and same number in thalamus also you should know. I'm not saying you should pinpoint, because that is impossible right now at this stage, though it should be there in the higher studies, but right at MBBS level you are not supposed to pinpoint each nucleus. That is not possible. But if the name is given, you should know what it serves the functions and what will happen if that is not functioning properly. That is what you should know, at least in case of diencephalon, right? Then comes the basal ganglia or basal nuclei. A lot of books still write basal ganglia, but it's basically basal nuclei, the CP, caudate, putamen, lentiform and all those nucleuses. Image identification, because a lot of transfer section of the brain, they may be asking you about this basal nuclei and the white matter fibers running between them. Mainly I'm talking of internal capsule, that can be asked. So pathways are also there, the direct and the indirect ones, function and applied part. Again basal nuclei, again you will find in some special classes. White matter projection association commissural. Projection association commissural, should know their examples. And the important one over here is the internal capsule, a projection type of white matter, which you should be knowing. Blood supply of brain, needless to say how important it is. The carotid system as well as the vertebro-basilar system. Both systems, branches. Nowadays be prepared for sub-branches, like we say na, M1, M2, M3, M4 branches from the middle cerebral artery, P1, P2, P3, for the posterior cerebral artery, A1, A2, A3, A4, from the segments of anterior cerebral artery. Basic idea should be there. What are these? Few images, this is showing you the cerebral hemisphere. Of the left side, some Broadman numbers, some important areas like the Broca's area over here, the Wernicke's over here. Middle part of the brain, just a few images, very important image. Labeled image, medial surface, that is the location of the third ventricle. You can see the relations of the third ventricle. Then interpeduncular fossa with a labeled image. So all these labels you can see. Optic nerve, chiasma, tract, mammillary body over here, the tuberous cinerarium over there. This is the area for the pons. Above we have the midbrain, and the nerves are coming out of it. Many things over there. What is this? This is the posterior aspect of the brainstem. Basically, the cerebellum has been cut. What we are looking at is the interior of the fourth ventricle. Basically, we are dealing with the floor of the fourth ventricle. The posterior part of pons and medulla. Very important image over here. Then spinal cord. Cut section is shown, but more important, I'm just giving you a brief idea of the images, not in detail right now. Various important tracts, 3 tracts, spinothalamic, corticospinal, and the dorsal column tract. Important part in this image is cervical to sacral area, cervical to sacral area, cervical to sacral area. If there is a growth from inside, which part it will involve? There is a growth from outside, which part it will involve first? That is the point over here. Brown Sequard syndrome over here, cerebellum, I told you cut section cerebellum, that is important. And then the ventricles over here, ventricles, CSF carrying cavities, right? This is just an image showing you the thalamus mainly, various nucleuses of the thalamus. You should know the arrows are telling you afferent or efferent. Thalamus, I hope we all know sensory relay center, which is afferent, which is efferent over here, that is shown. Blood supply of the brain, internal capsule, very, very important image. Okay, so this was neuroanatomy, and the next session will take up from the upper limb over here, right? So this was the whole part. In the comment box you can write the topics, because in the further sessions we will take up individual topics, and small sessions will be there to discuss those topics, right? So see you next session.